Well, welcome back to More About Birth. We're really excited about this episode. We have a special guest, but I'm here with Shannon Bennett and Angie Hansen. And Shannon, introduce your guest today.
I have my friend Molly McDougall-Brosi here today. She's a chiropractor, and I am really excited about what she's going to share with us because a lot of you have heard of having your newborn adjusted after birth. It kind of freaks people out. So she's going to talk to us today about why we would do that, how it's done, and kind of help you get more comfortable with it. It's something I suggest to my clients a lot. Mm-hmm. So take it away.
All right. So anytime a baby is born, there's some sort of traumatic event going on. Some babies it's more severe, some are less severe. Mm-hmm. C-sections, long labors, short labors, mm-hmm. forceps, vacuums, all of those different methods of getting a baby out can be very dramatic for a baby, but also how they're positioned in utero too can make a huge difference on how they come out, and then how their head shapes are, how their necks are, how their whole body is kind of formed and shaped.
And I actually have a pelvis and a doll for you to maybe show us some different things that might happen. I can hold this for you if you want.
So a lot of times, obviously the best position being here and baby coming out here, but sometimes we get that breech baby. Or we have babies that are transverse or sunny side up.
Just had one of those the other day.
Or even how they've been in the entire time, their heads could be tilted one way versus the other. And that's probably one of the biggest things that I actually work on babies with, is how their heads are tilted and in the birth canal and during their entire pregnancy. So all the different.
So that would be the number one thing you find that is a problem, is a baby with a head that's tilted to one side and they don't want to turn it to the other.
Correct. Yeah, that's usually the biggest thing because parents notice that. Mm-hmm. And then obviously there's also little subtleties as well that I notice as well. So we even have this baby here with some nice head tilt here.
Yep. Mm-hmm. Good old case of torticollis.
Yes. So what we have here, the baby is favoring towards the left, always leaning to the left and looking towards the right. So that is muscle spasms going on, usually on the front muscles, but also if they were in position that way the whole time during the pregnancy.
So if they're in there that way the entire time, is it that this muscle is stretched and this one is shortened because they haven't?
Yes.
They haven't
used. Yes, and no. So yes, this muscle pretty much was in a contracted state for an extended period of time, and this one was lengthened. But also, since this muscle was always contracted, this muscle didn't have the opportunity to learn how to fire properly. So not only are we looking at loosening up this muscle and stretching it out, but activating this opposite muscle as well. And I always go and send parents home with exercises, no matter how I work on them, because I could only see them, so often. But being able to have control and work on your own baby is really, really encouraging and empowering for parents alike.
And you have two children.
I do have two children, yes, and they both have had issues of their own. My son was early, little mouth, and he came out this direction, all right-sided, nice little bump on his head. And so I worked on him from the get-go. Then my daughter, right-sided torticollis. And whenever she opened her mouth on the right side, it was like this and super chomping on the one side, and the left side was great. So
it doesn't help nursing at all.
It does not. It was actually extremely painful.
Kids?
What about my kids?
I don't remember. Did your kids have any issues with sightedness?
They didn't. I had my first baby adjusted, but that was over in Minneapolis. So, I'm just super fascinated. I'm so excited to hear about this because we do recommend it to people and I believe in it, but I honestly don't know that much about it. So I'm glad to hear so that we can have knowledge about why we're recommending this to clients.
Well, it can totally affect breastfeeding. That's one of the biggest things with the sightedness, but then also maybe you'll cover just the spine in general and how it affects digestion, and colic.
Absolutely. The vast majority of what I see babies for is latching issues. That's probably 90+% of what I see for newborns is latching issues. Other ones would be if they're constipated, gassy, or just general fussiness, that colicky type symptoms. That's probably 10%, but they usually come along with breastfeeding issues as well.
Can you kind of just show everyone how you would do that? Because seriously, people are freaked out about going to the chiropractor for this tiny little baby.
Absolutely. So babies and adults, completely different body structures. So they're automatically, I work on babies completely differently than I do adults. They're basically just this big cartilage-based creature, sack of potatoes going on.
They're sharp.
So it's mainly really gentle pressure that we work on. So
So there's no crunching.
Nope. The amount of pressure that we do would be like checking a ripe tomato. So, the pressure of like a nickel. So very, very light. I always go through, show parents how much pressure I'm going to have on there, and
less than I would think.
Go from there. So automatically, check to see how they're moving. If they don't have any, obvious tilting favoritism going on, then I'll check side to side to see how their range of motion is too. And I could also see that when we turn the baby over too, and as they're lifting up their head, if they turn one way versus the other, and if they can't lift up on one side versus the other side.
So are you saying if you notice that your baby is definitely sided, they favor one side all the time, that it would be best to have them adjusted sooner rather than later?
That is correct, yes.
How soon can you do it?
Right away.
Okay.
Yep, both of my kiddos pretty much as soon as I was able to get up and move around. But that's a different case. I've seen babies same day, 5 days, months later. I mean, it all comes down to your parents' ability to come out and have the baby checked, whether you're comfortable being out in public or not.
So they could potentially make an appointment, come by on the way home from the hospital.
Yep, absolutely. So usually I go after I check their range of motion and everything. I always, check with their little hips too, and I check their sacrum because a lot of times too, it could be tilted one way versus the other if they kind of have a little twist in there. And then I go up and check the spine all the way through up. And a lot of times with that torticollis case, right at the base of the neck, there's usually something going on just because of all the muscles that attach down into the collarbone and into that upper part of the upper back, lower neck area.
Wow.
And then usually at this point, I have them turned around. And I go through, and I go through and check babies, their necks all the way up. And usually on the very upper C1 area, there's usually a lot of dysfunction going on there, restrictions, not moving properly.
So do you find babies, because I've had a few babies recently that have pretty prominent bones on either side, and I tell parents that in general, if it's bilateral, so it's equal on both sides, and you don't have like a big lump on one side and a tiny lump on the other, that it's generally fine.
That is correct, yes.
But what causes them to be prominent?
And it's how their head is tilted. So if you go through and just check on yourself, if you tilt one side,
Check on myself.
and the other side, you can feel it, it popping out on one side versus the other.
What about the bones right in the very base of the skull?
the occiput in there? Well, we'll get there.
Okay.
We're focusing on that upper neck area. I mean, that's when we get to the cranial bones.
I'm
We're
excited.
still on the neck area. So usually on this case, so most likely the baby's head is tilted to the left here, so they're going to have some issues going on this side. And there's going to be some tightness here on back here. So I usually do a little baby massage and then just really light pressure. And it's more of a sustained hold. It's not that forceful.
Like holding a tomato on both sides?
Yes, exactly. And it's usually actually just on one side that we're working on. I'm mainly stabilizing on the other side. So pretty much this, I'll use these fingers or these fingers and just do a light little hold. And just let it relax. Let the baby kind of relax into my hands. And most of the time they're sleeping and they stay asleep because it's nice and comfy and we usually have a nice little...
Can you see a difference right away? Like when you're working on them, do they relax right away?
A lot of times, yes. Or they will fuss right away because they're letting you know that there's something going on.
Angie's making notes over there. Do you have something you want to interject?
No, I'll save it for the end. Okay. Just my questions.
Okay. Yeah, usually they'll fuss. They'll let us know, kind of like when we poke on someone's back and we find that sore spot. Be like, oh, it's there. And babies,
She's
they
good at that.
usually automatically cry. So once I go through and clear out the spine, that's when I start focusing on cranial bones. And there are multiple different cranial bones going on that I go through and check, but there are some primary ones that I mainly look for. And it's the main one is that sphenoid bone here because it has 4 different connecting factors to the cranium, and then it connects to the hard palate too.
So it can affect nursing.
Absolutely. That's a major player.
You want to just
can
tip
you
the
tilt
doll
that
up
up
a
and see
minute
that?
and show us
So
where you're talking
right
about?
here on the side. So what I'm looking for is whether one side's bulging out. So this side on the right side is bulging out on this little guy here.
Wow.
But also the main thing that I'm looking for is the little divot, the little dimple on either side. So we have the divot on this side, but not so much on this side. So that's kind of progression wise what we look through various treatments. And the treatment plan is looking through the progress, especially right through here, and be like how everything evens out over time and with treatment. And so once I work on that, I also check back here on their little occiput bone there at the base of the skull, because a lot of times it can be shifted one way, one side sticks out more, and we kind of go through and feel and have sustained holding through there as well.
And I don't think some people realize that when a baby comes through the pelvis, there are different plates in the baby's head that actually fold over like this and fold over back to front and make the diameter of the head smaller to come through the pelvis.
Absolutely, yes. Yeah. When you're having that contractions, there's that overlapping, and then once they're relaxing through and the baby can work out more, it expands to kind of work its way through on out into the world. And also babies' heads, their cranial bones don't entirely fuse like adults do, because they have their little growing brain going on.
Yep.
And once they come out, sometimes we have a little overlap. They didn't entirely kind of shift back into normal, so I look into that as well, down the middle, down the sides, all throughout the cranial bones. And interesting fact, the frontal bone here in the front, with babies and children, there's still 2 separate ones, and adults it becomes one. It completely fuses together. So it's not just those
I didn't
sutures
realize. Yeah, I didn't realize
there,
that.
but with babies, there's still 2 separate ones.
Good to
As
know.
their bones go through and completely ossify and become one. And a lot of times that also clues me in on what side they actually have issues nursing on.
And how is that?
So usually on this, say, baby on this side, right side is up higher. So they usually have issues on that right side, and they do better on the
I'm
left
just taking
side.
mental notes, so when I look at
Yes,
my babies, I
absolutely.
can go.
And I mean, same thing here. So usually this baby, right at this moment, this baby is tilted to the left. So we're going to have better nursing on this left side. And then when you get to the right side, the baby has an inability to shift his head to the right. So we're going to have troubles there. So that's just another clue. And usually I know right away looking at the baby what side they're having issues on. And so, letting parents know that, and also their nursing positioning can be extremely helpful, especially side to side, stabilizing their milk supply and everything.
Can I ask a question?
Of course.
What are some
You're
of
sitting
the
over there so quiet. I'm like, why isn't she talking?
What are some of the top issues that you deal with aside from nursing?
Any constipation,
Okay.
colic, fussiness, and then it's not just nursing; it's also bottle feeding too. Babies don't their ability to be able to get the milk out properly, whether through it's a bottle or nursing, is highly affected on.
They have to be able to open their mouth good and wide to empty the breast properly.
Yes, and so that's where a lot of making sure those cranial bones are where they should be. But not only that, but I also do a lot of the jaw work inside too. So we go through and work on these little muscles on here. So this little guy is going to have a lot more tightness on the left side. So I will get my gloves out and go through and then check to see that tightness in there. And also I can send parents home with activating the certain muscles, especially these buccal muscles, which are those sucking muscles. So I always send parents home with exercises like we talked about earlier.
So it's not like they have to bring their baby back every 2 days or a month.
Yes, exactly. Most of the time I see, for fairly straightforward cases, my average is about 3 to 6 visits over 2 to 3 weeks.
Oh,
is
great.
what I see
That's
with
great.
babies. Babies, kiddos, they all respond much quicker than us adults do. And every day when I am a day older, I'm like, man, I wish I could respond.
Did you have another question, Angie?
Well, so along with that, I don't know if you can think of them offhand, but I'm really curious, what are a couple of your biggest success stories or like your most extreme cases that you can think of that came in and then you saw some differences?
And let me interrupt you there. I think it's time to go to a break. So can we get back to that when we come back?
Yes,
sounds great.
Absolutely.
Stay tuned to More About Birth. We'll be back with some more interesting topics about how to do chiropractic care on babies. Well, welcome back to More About Birth. We have a special guest with us. This is part 2, and we left you hanging at the last segment, so we'll pick it up right here. So, Angie, introduce our guest and let us know where we left off.
All right, so we're here with Molly McDougall-Brosi, our chiropractic extraordinaire. And we just asked a question. And so we're going to ask her what are some of the greatest success stories that she's had or some of the most extreme cases that she has seen improvement with when she's employed this technique.
So some of the worst cases that I usually see is a lot of that recessed jaw, where automatically nursing is difficult right away. So by going through and not only working on the cranial bones, but really emphasizing on a lot of that jaw work has really helped, one, bring the jaw out forward and then be able to nurse much better. I actually saw a baby not long after birth who wouldn't latch at all. And so going through and making sure, checking everything is, where it should be, and working on, especially in the jaw, that, mom and baby were able to nurse pretty successfully, right after I got done working on them. And, that's pretty amazing to see right away.
What's the biggest change you noticed? They're able to open their mouth
They're
wider?
able to open their mouth up wider, but also they're able to...
Does it change the suck?
It also changes the suck just
intensity?
because of how everything is connected. So you have, especially that sphenoid bone is connected to parts of the tongue, head bone's connected to the
Almost wanted to sing a song.
Absolutely. So a lot of that tongue movement is also affected on how your cranial bones are situated. So going through and working on cranial bones, working on the jaw muscles, and then you could track to see also how their tongue is moving side to side, up and down, in and out. There's been huge success after, 1 up to 2 adjustments right there, just because babies, they respond very well and very quickly.
That's great.
Super light, gentle work that we work on with babies. Like I had mentioned earlier, just the amount of pressure that you use to check a ripe tomato. So very gentle.
I'll never look at a tomato
You
the
will
same
not
again.
like, baby adjustments. Absolutely.
Is that aroma or a big beefsteak?
It's kind of across the board. I mean, it's not like we want to go through and jab a tomato and break the skin of that. But yeah, mainly that really recessed jaw and then shifting of the skull and cranial bones, torticollis, is the major things that I see.
Is there anything you can do for a recessed chin? Is that just mostly genetic, or is there an adjustment you can do to help that come out a little?
So there's a lot of times there's multiple components to when the jaw is recessed. And besides jaw tightness, there's usually some sort of tongue tie going on as well, which is a whole different
you had a great
and everything
question that kind of ties that all together with breastfeeding support otherwise.
Yeah, so the question we were thinking about was how do these adjustments overlap with lactation consultant? Do they overlap? Do you need to do one before the other? Just what have you seen in your practice?
A lot of back and forth. I work with a few different lactation consultants, but one mainly in general, which you'll have on your podcast, Susan Brady from Nurse Tri-City.
We plan to have her. She doesn't know it yet.
She's pretty sure she'll say yes.
But
I
text me this morning.
I work with her a lot. I send her patients. She sends me patients. It's kind of that, she goes through and works, does her evaluation, and very thorough. evaluation. And,
Yeah, I've worked with her.
and they're like, I'm feeling a lot of tightness in here. You should go see somebody to get that looked at. And then when a lot of times there's things that I'm not necessarily the best at, because I haven't taken all the lactation consulting classes, and there's a ton of information out there.
But you've nursed babies.
But I have nursed babies, so I know a thing or two. I will then send them out to her, and it's such a dynamic duo.
So it's a team effort.
Yeah, absolutely.
That's great.
Yes, yeah. I work with lactation consultants. I work with massage therapists. I work with physical therapists as well. There's a lot of different people that I work with just to give the best support and care for babies. And
Great.
Yeah.
So I have another question. You think of if someone has a C-section, at least in my mind, I think of that most of that birth trauma happening as the baby comes through the pelvis, and those bones really have to mold in a way that they don't for a C-section. So why would a baby who has been born by C-section need one of these adjustments, and what can it do for them?
Well, and that's also coming through how they're positioned in utero. They don't go through the molding process, but their heads positioning can be to one side and cause a lot of pressure on one side versus the other.
So we've seen babies that have ended up in C-section, and when they come out, you can tell exactly what position they were in there because they've got a caput on this side or back here. You can tell that they were, tipped
Right,
back,
just from the
and
labor.
extended.
Side to side,
Right.
Yeah.
Absolutely.
Is there anything about the way a baby is lifted out of the womb during C-section that could also necessitate needing an adjustment?
Yes. Oh, always. Depends if they're coming out, neck first, if they're literally, pulling them out one way versus the other. And that could go with vaginal births as well, being vacuumed out, being pulled out, forceps.
I was
out.
born with forceps, and my hips have always been out of alignment.
Really?
Because
I didn't know that.
Yep.
Learn something new every day.
fun fact of the day.
So
Those salad spoons.
So I was born breech. So does that change the game?
That can definitely for sure, because that puts a lot of pressure more so on their little sacrums and hips and legs. And if they're up, like this the entire time, a lot of that hip dysplasia can also come to work.
Yeah,
as
breech
well.
babies are funny. Pop out and their little legs go like this, right up by their ears, and they just fold in half.
That's how Keith sleeps every night, isn't it?
That explains why I'm so comfortable in a kayak.
Automatically just hunched on in there, little safe place. But a lot of that lower back sacrum stuff, which is why I always go through and check the spine and work. Usually I work my way up, but that could also affect a lot of how their digestion is working as well. So if they're in their kind of like that flexed up position for an extended period of time, it puts a lot of pressure on certain aspects of their joints in their lower back area, which can then lead to constipation. So usually constipation, gassy babies all need some work as well.
Something going on. So do you have more questions for Molly?
Have you ever had a baby be injured by any of these treatments?
I have not had a baby injured. They usually get kind of mad because they're sleeping and I accidentally wake them up. That's the extent of the fussiness.
Or you have to unwrap them and they get cold.
Yeah. I usually try to keep them as warm and comfortable as possible. And then if they don't always stay on my table in their little pillow. A lot of times I will hold them and work on them. I'll give them to mom. I'll have mom.
In fact, you have a little blanket on your lap here. You were going to show us kind of how you position them.
I have a pillow in my office that I use that's nice and round, and babies then get in that nice little comfortable position this way. And so then I go through and I can evaluate and look at them this way, make some good little eye contact, and then I could turn them around a lot easier when they're in the pillow too.
Right.
So I could work on them that way, and they usually like to sleep and be all cozy in there. And a lot of times also when you hear babies crying in my office, a lot of times
Molly's picking on.
So mean. It's usually because they're really tired or they're hungry. And so working on, a just fed, either currently sleeping or, just woke up baby is ideal, but we all know how that goes with kiddos and trying to get them out the door, because they usually have a blowout at some point in time when you're trying to get out the door.
Inevitably.
And they want to eat if they're awake. So.
Absolutely. So that's most of the time where we get that crying aspect, and when the babies are older. Nice little newborn babies who sleep through everything. They kind of just are perfectly content and keep sleeping the whole time while I work on
We've discussed before, like the cost of chiropractic care or insurance. Does your insurance cover chiropractic care?
Ours does, but some people's don't, and that's a big question for a lot of people is the cost.
Yes, absolutely.
Is there a cash pay discount?
We take
at time of visit.
We take insurance, and we take cash as well, or the at time of service. And for any new patient, it's $60 for the cash rate and the $40 thereafter.
Okay.
And then a lot of times we also work with families as well, multiple families. When we have mom, dad, or even other kids, we go through and work with everyone. So being able to, if you can't afford care, we will automatically always work something out, because it's extremely important for everyone to get worked on.
Awesome.
Yeah. So
Well, as I'm sitting here processing this, I'm thinking about what a difference as an adult it makes when you can't move your neck or you're in pain and you're uncomfortable. It affects your emotions. It affects everything.
Yeah.
And think what a difference these adjustments can make for babies, which affects moms and families. And I think what we're uncovering here is that really the world would be a better place if all the babies got adjusted.
It's so
I
true.
wish all my babies saw a chiropractor. I'd like to have a chiropractor on retainer to come to the house after every birth and adjust mom and baby.
Yeah, I would like that.
That would
too,
be
if one
amazing.
followed me around every day.
Yeah,
preferably myself, but I can.
Well, if you ever want to do that, let me know.
Yes, someday, definitely in the future, I would love to come and work on mom during labor and after birth.
It can make a
babies as
huge
well.
difference. Yeah, and we'll actually have another chiropractor come and talk to us about prenatal chiropractic care. We wanted to focus on craniosacral and infants with Molly.
They do both.
So tell us where you're working.
Yes. I work
And
at
how to get a hold of you.
Core Concepts. We have 3 locations. I go between our West Richland office and our Pasco office. And the best way to get a hold of us, we have multiple numbers, but no matter what number you reach, you will call somebody and get a hold of them. But the main one, the Pasco office number is 509-380-5825.
And you are in West Richland on
Tuesdays and Thursdays in the afternoon, and Monday, Wednesday, Friday in Pasco morning and afternoon.
Okay. And are you still kind of on a partial schedule because of having had a baby yourself recently?
I did, yes. I work 10 to 5 and then 1 to 5.
Great.
On Monday, Wednesday, Friday, 10 to 5. And
long-term plan is maybe to go back to full-time, or are you going to kind of stick with this routine?
I will add some more time into it. And like I said, as my babies and toddlers get older and they're not nearly as dependent on me as they are now, I would love to, expand my hours.
Yeah.
And also, like I said, be able to see
One
in
of
action.
The things that I love about chiropractic care, I don't know about you, but it's not hard to get in.
It's not, no.
Right. Yeah,
Because
that's awesome.
like you're willing to squeeze me in when it's just like, okay, I have an hour here between clients and I'm dying.
I will always work to get,
Yeah.
patients in fairly quickly, same day, next day.
It's not like waiting 2 months to get into your, doctor or the OB
Pediatrician.
or whatever, right?
Yeah. Well, that's huge because when you've got someone that's in pain or your baby is crying or won't nurse, those hours count.
Yes, absolutely.
So that's huge.
Well, and when we were growing up, my parents, we didn't go to the doctor unless somebody was cut open, needed stitches, or had a broken bone. We went to the chiropractor. And I remember times having the stomach flu, just being dead on the floor in the living room, about 8 or 9 years old. And he'd stop at our house on his way home from work and adjust us.
Wow.
So it makes a huge difference when, especially when kiddos are are sick, getting them work done. Every time my kiddo is sick, it's automatic
Yeah.
adjustments for sure.
Because if your body's in alignment, it can heal itself.
Absolutely. When your body functions properly, it makes a huge difference. And, I kind of just go through and help your body function properly. It makes a huge difference for sure.
And I'm getting the signal that it's time to bring this to a close. So thank you so much. And maybe we'll have you back again.
Yeah, Thanks, Molly.
Thank you guys.
Well, there we have it. Another episode of More About Birth. We want to thank you for joining us. Share it with your friends. And we will see you here next time on More About Birth.